You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with migraine headaches and just overall general headaches. With us, we have a dentist that is getting amazing results with his patients. And we're talking about a new technology, a new approach, TruDenta. With us, we have Dr. Christian Yates. Dr. Yates, welcome to the program.
Thank you, Randy.
Now, is that so? It is. You are treating people with migraines and headaches with great results.
We're treating people with migraines, with headaches, with TMJ, with something called tinnitus, ringing in the ears, all muscle problems of the face and neck, people that have bite issues.
Okay.
So you may know people that, maybe their bite isn't just right. We treat people like that too with this protocol, TruDenta.
Okay, good. So for people that don't know you or know your practice, and we've had you, we've had a discussion about no more dentures.
Right.
But for people that don't know you, tell us a little bit about your practice, because you have a general practice, you have a team approach.
We have a general practice. We have 3 dentists that work in our practice, and we do just about everything. So we do dental cleanings, fillings, orthodontics, limited orthodontics. You've heard of 6-month smiles. Maybe 6-month smiles is where we straighten the teeth in 6 months for adults. We do dental implants. We do cosmetic dentistry, smile makeovers, veneers, crowns, root canals.
Okay.
So we have a we have a practice that encompasses just about everything in general dentistry.
Okay, good. Okay, so this migraine headache part of your practice.
Yes.
How'd you get involved?
Several years ago, I got a fax from a company called TruDenta, and I was very skeptical. I read through this fax, and dentists have been trying to treat TMJ and headaches for years and years and years. Some successfully, some not so successfully. So I read the fax, and I said, I don't know about this. And I talked to Dr. Joe about it. And he said, why don't we just call him? So we did. And I started to call other dentists in different areas of the country that were doing this protocol on their patients. And I was amazed at what I was hearing. I mean, I'd never heard success stories like this before of people that had suffered with headaches for their entire lives, some of them. And all of a sudden, these headaches were going away.
Interesting. So what's the connection, though? This is the part, and I want to ask you about, that. What's the connection between what a dentist can do and a headache?
Okay.
Or a migraine headache.
So people go to different doctors to have headaches diagnosed and treated.
Okay.
So neurologists, some people see chiropractors, some people will go to their family doctor or internist. Usually the standard protocol to treat people with headaches involves medication or needles or things like that.
Okay.
And what is overlooked for many years has been overlooked is how the teeth play into all this.
Okay.
Now the teeth and all the nerves in the face and the head all go through an area in the brain, which is where the headaches start. Okay, so there's a little tiny place about the size of my thumb in the brain, and that's where the headache center is. That's where people start. They get headaches. Okay. So if we're able to help the nerves, basically heal the neural system.
So the nerves that go to the teeth.
The nerves that go to the teeth go through the exact same spot in the brain, and the nerves in the eyes, in the jaw, in the back of the neck. All these nerves go through that little spot. The idea here is to reduce the inflammatory processes that are going on and help these little, they're called glial cells, is to kind of turn those off. So what we're trying to do is calm the system down. I use this analogy a lot in my practices. You have imagine a glass of water. Okay, people that have headaches, the water in their glass, it gets full and then it tips over. So you're spilling out this water, and it goes into a headache or a migraine. Most of us can manage that glass. So, the water kind of goes up and down, but people that have that much stress or inflammation in their body, it just tips over. And the idea is to take some of that water out of the glass.
Okay. Take me through the process. I mean, you've seen patients that were suffering with migraine headaches in particular.
Yeah.
That those have gone away.
Yeah, we have patients that come to us that have just chronic headaches. Again, we have people that come in, they just have pain in their face. They can't figure it out. And that pain will graduate into something else like even a migraine. Okay. And something that's important to know is that some people have headaches, they don't even realize they have migraines, but they have migraines, but they don't know it. So
what's the difference, by the way, between a regular headache and a migraine? I know a migraine's tougher or bigger.
People tend to think that, unless I go into a dark room, or if I get an aura, and if I, vomiting and things like that are all associated with migraines. But people actually can have migraines that don't have all those things too. So it's really important for people to come in and get diagnosed properly. That's part of the key, is the correct diagnosis. And that can be done painlessly and very easily within a very short period of time. And we can find out, is this somebody that we can help that has migraines, facial pain, TMJ, all those issues.
When you really, so in the dental office, okay, because you're doing like a combination of physical therapy, you're using technology like cold lasers and TENS units, manipulation on the jaw.
Yeah, we actually, one of the very important things we do, again, going back to, well, why would a dentist be treating people with headaches and migraines?
Yeah.
Okay, why is that important for a dentist? The thing is there's not another doctor out there that can treat the teeth, that can adjust teeth. And that's why TruDenta came to dentists and said, listen, we have a protocol that was set up. There were some very brilliant doctors. And being a skeptic, when I first found out about this, I went and trained and became certified to do this. Okay. And when I went down and trained, some of the most brilliant dentists I've ever met were literally just like, I couldn't believe that this protocol had been developed and that now we could actually treat people with these issues. So,
so the way their teeth are coming together can have something to do with it, like an irritation of a nerve. I'm trying to figure this out, that can lead to a migraine.
So even people that don't have headaches can have their bite off. So I had we run ourselves through the test first. Okay. During the certification process, I had to go through all this too. So one of the things we use is dental force analysis. So we use something called a T-scan, and it shows all of the little areas in the mouth. So dentists for years have been using a little paper. I don't know if you've ever had your teeth. You tap on the paper, tap, tap, tap. So it shows in marks on the teeth where the spots are, where they're touching, but nothing ever showed us how hard they touch. So no one ever measured that. And now we can measure that, and what we're finding is there's little areas, like even in my own mouth, when we run through this little test, you bite, and they said, where do you think you're touching hard? Oh, I don't know, over here. I had a huge interference, so a huge area of pressure on one tooth, and once like 2 months later, the tooth cracked. Okay. So that's how much pressure. I had no idea. But these interferences and these imbalances in the bite can cause problems in the muscles.
So the nerves that go to the teeth for pain are the same nerves that go to the brain for headaches? Or that cause headaches?
All these nerves go through the same areas. So the optic nerve, the nerve, the eyes, the muscles of the face, the teeth, they all go through that same center. They all kind of, if you can imagine, they all kind of come together there.
Okay.
And so any inflammatory processes in that area can be caused or cause problems in other areas. So the key, one of the key things we do for people is something that we teach them to do this at home, and that is to, I don't want to say reprogram the nerves, but we try to heal those neural pathways.
Okay.
And we can do that with, there's a medical device that we can use that helps kind of reprogram, or if you will, heal those pathways so that the brain stops thinking this is this is painful.
Okay. We're going to take a quick break. We come back, though, more about the process, what somebody could expect, and what the diagnosis or the diagnostic process is like.
Sure thing.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I have been migraine-free since September, and it's amazing. Everything's more clear at work. Everything's clear. I can focus a lot more. I have a lot more fun.
And after going through the therapy, I felt like a new person. Sorry. I haven't had a headache in 3 days, where I suffered for 3 before we came. And I slept great and feel wonderful.
It's just overwhelming to know that maybe life can be so much better than what it's been. And being able to smile and be excited about the day instead of thinking, okay, how am I going to get through tomorrow?
So in your office, what's that process like?
Generally, our patients come in, or people will come in for the first visit, and it's a consultation. So we just want them to come in and let's get to know who you are.
Okay.
We have them fill out a head health history. So it's a little form that we find out things like, have your dentist ever asked you if you've been in a car accident before? So that's important to know. Any trauma that happened, sometimes we find...
Because that could have jarred your bite or jaw?
We find that certain women that were involved in sports as kids, so if you were in gymnastics and you sustained a consistent low trauma. It doesn't have to be a heavy blow, but even just a low trauma to the same area over and over and over again, like they do when, you know, these kids are in gymnastics and things. Years later, that can cause or lead to headaches and migraines. Orthodontics can lead to headaches and migraines when they change the positions of the teeth.
Okay.
So we try to find all that out initially. We do a trigger point examination. So we do a kind of a subjective part of the examination then, and then we can determine whether or not do we go to this next level. And the next level is what we call a screening. And a screening visit is where we pull out all the stops. So we use some of the most advanced diagnostic tools we have to find out exactly what protocol is appropriate for this certain individual and what do we need to do to help them get well.
Okay. So now you have a therapist in your office, what's their role?
The role of the therapist is really to do a lot of the manual therapy. Like you mentioned, we use cold laser. We also use ultrasound, manual stimulation. We're trying to get out some of the knots, if you will, in the muscles in the face and the head and the neck. Okay. And then at home, there's also a part of this. It's a home, so the doctor's involved. I usually come in and work on the teeth. So whatever part the teeth has to play in this whole process, the therapist works with the patient, and then also at home, there's a protocol and a program for the patient to do at home, so that they can help themselves get better. Okay. And this is done without shots, without needles, without medication. It's a very natural way to help the body heal itself.
So your success rate, though, you told me, with headaches, migraine headaches, with the patients have been a 90% so far.
So yes, but let me tell you, if they followed protocol, so everybody followed protocol, that has followed protocol in our office has a 100% success rate.
So far. And we have to be careful with saying this,
we do
because
show. You know what, it's
like
not
results
100%.
Not typical, things like that.
Correct. So can I help everybody? Can we help everybody with headaches?
You personally, in your practice, have had a 90% success rate.
We have had an enormous success rate, and if somebody follows the protocol that's developed, you know, not everybody follows the directions.
So in your office and at home care?
Yes. Those people get better, bar none. And this is what we promise people. We're not here to promise people that, you know, you're never going to have a migraine again, you're never going to have a headache again. Headaches and migraines rule these people's lives. That's all their life revolves around their migraines or their headaches. So they can't do the things that you and I just take for granted every day. I mean, you come to work every day, you go out and you spend time with your family. Yeah. These people are literally trapped in their homes, some of them. They can't go out to eat. I'll tell you a story about a woman who came into my practice. I actually met with her husband. Her husband came in, I said, so how can I help you with your headaches? He says, I don't have headaches. He says, it's her. It's my wife, and she's over here in the corner, and she's just almost like not even a person. Wow. And he says, what can you do to help her? I don't think we can stay married. She's not the same person I married. He says, is there anything? We've tried everything. So he's in your waiting room, his wife's there, she's pretty miserable. She's totally miserable. Every other day she has a migraine. She has terrible headaches. Even when she's not having migraines, she has a headache. She has this chronic pain in her face and her head. So I said, you know what? Here's what I want to promise you. I want to promise you that I can help you get better. Can we take your migraines away forever? I don't know. But can we help you get better? Can we help you get off some of these medications? Let's shoot for that. Let's shoot for making it so that your migraines don't manage your lifestyle, so that you're able to go back like you and I, which is, you know, I get a headache or I don't feel well, but it's not like I plan my life around my headaches. Within 6 weeks, she felt like a different person, and I interviewed her afterwards, and I have a video of this woman. She's like a totally different person. She came to the initial evaluation. She wasn't wearing makeup. Her hair was a mess. When we finished, she looked like a totally different individual. Great stuff. I want to thank you for coming on the show. We're going to have your partner, who also brings something to the table as far as what this migraine headache protocol can do for people. So thank you very much for coming on the show. Thanks. You're watching The Wellness Hour. I'm Randy Alvarez. Look, if you're suffering with migraine headaches or headaches and you think you've tried everything, according to my next guest, if you haven't tried TruDenta, you have to take a closer look. We'll be right back.
And I noticed a huge difference. It wasn't until, you know, after maybe 2 treatments, it felt really nice, and I wouldn't have the headaches anymore, maybe once in a blue moon. And then one day I was driving, I was like, oh my gosh, I haven't had a headache in forever, and my jaw isn't hurting, and it's just helped so much, and I love it.
talked yesterday, I really went through one of the sessions, the therapy sessions, completely for the first time, and my range of motion and my opening was dramatically increased, and I woke up this morning without a headache. So I'm very, very excited about it. It was the first in a long, long time. I could cry about it right now, but it was first.
It's just been the most amazing experience, which I had never heard of before. And no one I talked to who was wondering why I was driving to Philadelphia from Delaware to see a dentist all the time could believe or had heard of this. So I'm really thrilled that I had it done, and I'm happy to share this information with you, and I hope and know that it would also help you.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. No more migraines, no more chronic headaches, according to my next guest. New breakthroughs, new treatment options for people that think they've tried everything. With us, we have Dr. Hafanda. Dr. Hafanda, welcome to the program.
Thanks for having me, Randy.
Now, in your practice, and we've had you on the show before talking about, you do cosmetic dentistry, you do dental implants, a lot of general dentistry. But something kind of fairly new for your practice.
Sure.
Treating people with chronic headaches, migraine headaches. Tell me a little bit about what you're doing.
Well, we've discovered that there are a lot of people that suffer from headaches, migraines, and different variances of those for years.
Okay.
And even when it comes to how the teeth come together and biting, people get headaches from that as well.
So, and this is the part, and I asked your partner this too, is because I'm skeptical a bit, right? And I've heard some of the testimonials, the patients that have had this done, that had migraines, now they don't have migraines, but the mechanism, I guess, how it works. And I don't need to get every detail, but what's the connection between what a dentist can do and somebody getting migraine headaches?
Well, the different modalities that go into the treatment with TruDenta are such that there's a certain part of that only a dentist can do when it comes to adjusting the bite, adjusting how the teeth come together.
Okay.
The other modalities are not key to dentistry, but TruDenta has embodied those and brought those together that with the whole system in place, it has been tremendous for our patients.
How'd you get involved?
Well, like you were saying, we were very skeptical because we would first put people in bite splints and say, okay, chew on this thing at night and hopefully your headache goes away. We found that it may protect teeth, but it didn't really help the whole situation. So when this came about and we heard news about TruDenta, we were like, you know what? I wonder if that's really true, because this would open up a whole world for us to be able to offer to our patients, because we've heard for years from our patients that, you know, they've been having headaches, they've been having migraines. Sometimes it keeps them from enjoying life. Okay.
So you got involved. Okay. It's like a specific protocol. I mean, you guys are pretty aggressive. It's like physical therapy, some things in dentistry you do, cold laser, TENS units, at-home care.
Right.
Tell me about your first patient, because you said it was like the best, your first one.
Right. And this is the thing. People who suffer from migraines and severe headaches, they almost go through a severe depression because it hurts all the time. They miss a lot of time from work. They miss a lot of time with their kids. So just their countenance, they look frustrated. They are. So they have a certain look to them. I can't really put my finger to it, but they just don't look happy.
Yeah.
And after we had explained kind of what we could do for her, she says, sign me up.
Well, what was her problem, first of all, your first patient?
She had been having headaches for about 15 years. Now, she had been in a car accident before, so there's been some things from that over time that have contributed to the migraines.
So she was in a car accident, like it put her jaw out of place or something?
Jaw out of place, her neck kind of whiplash, what she was telling us that she had suffered. And even then, it doesn't have to be something as traumatic as a whiplash injury. It could be if you're in high school playing sports, you get a little neck injury, you don't think nothing of it. But over time, as the scar tissue in the muscle starts getting bigger, your range of motion goes lower, and you start...
Your mouth range of motion, you mean?
Range of motion of your neck.
Of your neck?
Range of motion of your jaw.
Okay.
So yeah, that affects everything as a total.
So with this woman, she was in the accident.
And like I said, she came in, she says, sign me up, I'm ready to do anything. I've tried medications, they're not helping me. She said initially they first started, she could control them with medications, but over time, she says it basically couldn't help. She had to go into a dark room, lay down, and again, she said this would last for hours.
So what'd you do?
Well, we ran her through the TruDenta process.
Okay, were you a little worried?
Bated breath, fingers crossed, because you know she was my first.
I mean, you
patient.
had a lot of training. You went through a certification program.
But there's nothing like.
You had to be nervous the first time.
Right, because there's nothing like seeing this work in action.
Okay.
Okay, and we always warn our patients the first couple times we do the therapy in office, sometimes that can trigger a migraine, but typically after about 3 or 4 sessions, their countenance changes. They look happier. You know, it's.
So for her, it worked.
Yeah. Once we got through the 12 weeks of therapy, I'm telling you what, she brought us a big basket of goodies. She says, I can't tell you guys how much you've given me my life back because I'm not having downtime from work. I can actually do things in the evenings with my kids. I can think clearer. She goes, it's a whole new world for me. And that's when it really changed because again, that whole skepticism was there. But when you first saw it, even when we went to our certification, we saw a lady that had severe migraines for probably about 9-10 years, could barely open her mouth. And just the first session, she was opening really wide. She was being able to move her jaw, which you know, all our jaws kind of dropped at that point.
Okay.
We didn't know how effective this was till you saw it. And that really just kind of gave you the confidence to go.
Now, you've helped people in your practice as well.
Oh, yeah.
So women in your practice
Yes.
with migraines or with headaches, that they're gone.
Oh, yeah.
Gone 100%?
Well, for one who's had the migraines for about 15-20 years, she says maybe once or twice a month, but with not the severity. She was out half the month
So
with
15
headaches.
days a month.
Yeah, she was having headaches. She was saying that she could not have, she could not join her kids in their activities. She couldn't go to their ball games because this was really affecting her daily life. 15 days out of a month. Can you imagine that?
Wow.
Yeah, our kids would disown us, right?
And so now?
Now she's able to enjoy life. And here's the thing about it. Once you go through the process, the home care that you're instructed to use, that's about 30% of the success of that system depends on your home care. And there's a unit that uses cranial electrostimulation that really helps get those brainwaves and retrain pathways, neural pathways, so that way use of that plus their jaw exercises, it really helps them.
It's a practice you've had, according to Dr. Yates in your practice, about a 90%, not even about, a 90% success rate in your practice. And he said, there's only really been a couple that it didn't work for.
Right.
And those people didn't, according to him, didn't follow the at-home care or dropped out of treatment.
Right.
But otherwise, it's been 90% of the people.
Right. Here's the thing.
Big improvement.
Right. People want a quick fix. And those are the type of people who want that, pop that medication and really be done with it. Little do they realize over time, that doesn't work anymore. So you do have to go through the modalities of therapy for it to be most effective. And, you know, for those who are impatient, I'm sorry, but yeah, it may not work if you don't follow it through. It's just like if
you have like different levels. I mean, if somebody has minor migraines, they come in like maybe 2 or 4 times.
Right.
Therapy sessions.
Right.
I'm calling it therapy session. Is that what you guys call it? Okay. And some may have to go 12 weeks.
May have to go 12 weeks, depending on the severity and what triggers your migraine.
And you believe it works?
Oh, absolutely.
You're convinced?
Yes, by all means.
Okay. All right. Final message, because there's a lot of people, I guess, a lot of women, in fact, anticipating you coming on the show. I know a few people that get migraines. And they say, I've tried everything. So what do you say to the person, the woman, the man, specifically women, especially because that's who I ask, that say, I don't know, I'm very skeptical. I can't imagine going to a dentist for my migraines. What do you say to
Randy,
them?
that's totally understandable because I was skeptical at first too, before we got in there and started doing the work and really seeing the results. What I can say to the viewer who is going through the migraines and the headaches and just the debilitating effects they have on them is that, you know, what would you miss out by not at least coming in to see what we can diagnose and find out for you?
Good, good. How predictable or with certainty, because I know you do a diagnosis or a consultation and some testing.
Sure.
With what certainty could you tell people, I think this is going to work for you?
For the consultation, just getting through that, we have a pretty high idea of what is going to be needed. The diagnostic testing just kind of seals the deal. When the patient sees the limited range of motion, the force balances that their bite contributes to their migraines and headaches, they see for themselves, well, something is off. So in their mind, they're saying, man, and we explain them what we do to soften those forces and to get everything working together. It makes sense to them because, you know, they've tried medications, they've tried everything under the sun, but not TruDenta.
Interesting. Okay, good for you. I want to thank you for coming on the show.
Well, my pleasure.
And it was a pleasure having you and your partner on the show. So no more migraines. That's the goal.
Oh, absolutely.
Headaches. And you know, this people need to know also, this is a real interview. I'm not endorsing you. But I should mention that, you know, my show airs throughout the United States and Canada. I've interviewed hundreds of dentists over the years, a lot of medical doctors and dentists that believe that, you know, if you've got a problem with your bite or that there's a connection with migraines.
Yes.
And I've even heard that dentists that may fix a problem with a bite.
Oh yeah.
And as a side effect, that means the person's migraines went away.
It's even as little as, or we can create them. That's the scary part. You can do
bad dentistry could also
yeah, and it's not even the dentist's fault. They put a filling back into a tooth, into an environment that is not properly functioning. Well, that means it will never be working right. You have to fix the whole.
Give us some last minute left symptoms.
Okay.
That would be an ideal candidate or potential candidate. Okay, so they have migraines. What are the other symptoms?
Well, here's one thing. I mean, when you bite together, Randy, do your teeth come together?
Yes.
Okay, that's good. Some people who get migraines and headaches, their bite is, how their teeth come together is not balanced. They hit first on one side, slide under the bite. Or they don't even bite on certain parts of their mouth when they have teeth there. So it's not normal to not have your teeth coming together at the same time. So something like that could be contributing to your migraines as well.
Okay, good. So make the call.
Yeah.
And I know on your website, I guess you guys have some videos.
Sure.
Testimonials
of patients who have gone through the therapy. And even if you want to jump on the TruDenta website, there are hundreds and thousands of people that
go to TruDenta.com.
TruDenta.com. Check out their videos. Check out their testimonials. It's real.
And this is science-based.
Oh, yes. Oh, yes.
Okay, good. I want to thank you for coming on the show.
Well,
Very
my
interesting.
pleasure. Thanks, Randy.
All right. You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.